So the two assessments that I pulled for this competency are the tracking and the confrontation test. These two tests are both vision tests, specifically the confrontation test, the visual field, specifically the side vision or peripheral vision. The tracking assessment tests scanning and ocular motor function or range of motion of the eye muscles. Both of these assessments are non-standardized and fairly easy to administer. They're both considered a screen as a standalone evaluation. Most of the time, this evaluation and assessment is done when someone comes into the OT clinic when they're on their first initial evaluation. When doing the confrontation test, you first have to make sure the client can see your hand in each of the 4 quadrants before starting. Each eye is going to be tested individually, so that means the client's going to be covering one eye, and then you as the therapist are going to be closing that same eye to kind of get a feeling of where their visual field would end at, like, when comparing it with yours. In this test, the patient is looking directly at you, at your eyes or your nose, and again, like I said, you're going to be testing each individual quadrant, 1, 2, 3, 4, and then you're going to be showing number in their visual field in one of the 4 quadrants. So you'd be coming at them kind of like this, and they'll be looking straight at you, and it's testing to see if they can see that. Without looking at the camera, probably about right there, I would be able to see it. So the normal ocular range of motion for that is about 95 degrees this way, about 65 degrees up, and about 70 degrees down. This test can also be assessed with an OTA from behind the patient. So the occupational therapist will be standing behind the patient and assessing the client's visual field by having maybe 2 different color markers. And then the patient will either just point to when they see the thing or name the color of the marker, again testing all 4 quadrants. And the OT will be sitting in front of the client and testing to make sure that the client does not move their head or look, because the point of it is testing peripheral vision and they need to be looking straight ahead. So it would not be very accurate if the client were moving their head. The difference in this is when testing from behind, it's stated that it is more of an accurate test of peripheral vision. So with the tracking assessment, the patient is asked to look at and follow a target with their eyes. And it's moving horizontally, vertically, or in a rotation. So the best pattern to do this would be in H patterns or X patterns to get through all 4 quadrants. The person doing the assessment typically uses an object such as a pen, but if you're assessing a child, for instance, you could also use a toy. And typically this object's about 18 inches in front of the person's face, so about 1.5 feet. For this one, you're also going to be checking for nystagmus, which is the rapid beating of the eye. And also, you're going to check if there's any pause in fluid motion, because if you're tracking and then the person's eye suddenly stops, like right here, and it happens to be on the left side, you got some left side neglect going on, and you need to note that. So the population that the assessment is typically administered to is anybody that is suspected to have a visual impairment or has recently suffered a neurological traumatic event. So, someone that has recently suffered a stroke or a TBI or anything neurological that could impact vision. However, as I stated earlier, this is typically done at an initial evaluation. So, vision could be tested with any population in any age. With younger kids, you might just have to get a little bit creative in order for them to be able to track, and maybe the confrontation test might be a little hard, but you can have a parent sit in front of the child, distracting the kid, and then the OT can come up alongside the child and move a toy. And as soon as they see it, I'm sure they'll like turn their head towards the object, and that would be a very good indication that their peripheral vision, their line of vision, is right there. So to report these results to an interdisciplinary team, it's pretty straightforward. These are more of observing and make your own clinical judgment with that. For example, if they do not give a response or they give an incorrect answer, it can indicate either a visual impairment or possibly a neurological impairment, depending on if you found tracking errors, again, when they just pause, or nystagmus, which is the rapid beating of the eye. Again, if given a no response or an incorrect answer to the number of fingers or the colored item, like the colored marker possibly, there is that, like, that has to be noted and explained. Then you would take note of what side and what quadrant was suspected to be impaired. So you could report it to the interdisciplinary team for further evaluation and assessment, as well as possibly referring out to an ophthalmologist for a better visual assessment to kind of narrow down what exactly is going on with the client. Or a neurologist, depending on if you think it is more of a neurological issue and less of a visual issue. If there were no problems and they did everything correctly, I would just explain that no visual issues were found at this time. To summarize, if the individual is not able to track the pen or object with only their eyes, you have to make sure that the patient is not moving their head and only their eyes, because if they are, they would be considered compensating. It usually indicates that the client consciously or subconsciously knows that they have something going on with their vision, and they are acutely aware of it. You would have to report that, and again, nystagmus or pauses in smooth eye movement. Again, as both of these could indicate a more serious neurological issue.